this is Dr. Cidambi from United States of America, your psychiatrist. I am going to dive into this viewer's question about a very important topic here. So today we are going to tackle something which is very important for anyone who is experiencing substance use addiction themselves or who they are dealing with their loved ones. Relapse is a huge topic. What causes it, how we can reframe this. Not really it's a failure. It is so important that the idea that so many resources point out that recovery isn't the perfect straight line. It's the one and done idea. It's so rare when people go with that kind of expectation. They are setting themselves up to feel defeated from the get-go, which actually feeds into this myth, and this relapse means you are weak and it is a failure. And that's a myth. That's a myth. Pretty much every single source says that it is a relapse. Relapse is a process. Relapse is not something that rare. It's as common as catching common cold during flu season. So in fact, 40 to 60% of people who are dealing with addiction will experience relapse one or several times. It's that common as catching cold during flu season. So it takes the pressure off when you think it in this way. Exactly, if you experience one or multiple relapses, you're definitely not alone. And it's so important, and it makes you wonder that if it is that common, why is it so much of shame and stigma around that? It is interesting because there is this disconnect where intellectually we understand this is a chronic disease, but emotionally we are thinking it is a failure. Look, if someone suffers from diabetes, if they are really doing well by managing their blood sugar, if they're going to have a slice of cake, you wouldn't shame them for that. You would probably offer them some support. Okay, how are you feeling there? How can we support you, kind of thing. But with addiction, I think there is this tendency to relapse as a failing, personal failing. They're not looking this as a part of the process. So if you mess up one, you're back to square one. That's not true. That's really not true. Compared to other chronic illnesses, this will be poorly dealt with. And so we need to look at this like any other chronic disease. Slip-ups or setbacks comes as a part of recovery. And we need to learn from the relapses. The relapses are so common. So what are some of the things that contributes to this relapse? Is it really the matter of willpower, or is it like the other factors? So it's not just the willpower. That's a misconception. It's a neurological factors that are also part of this relapse. So willpower alone is not enough. You need to understand why these relapses occur. What's going on in our brain? So most important thing to understand is that imagine you are using for years and the brain is, kind of forming superhighways. When you stop using, these superhighways are getting closed. So it's time for your brain to adapt and readapt. That's called the neuroplasticity. So the habits and the thoughts, so those kind of thing, the brain is going to be rewiring it. It takes a while to rewire. The brain takes up to 90 days or even more, sometimes even longer, for the brain to really produce those chemicals naturally. That's a long time to be fighting, and it is not easy. And early recovery is a very vulnerable state of this illness. So you need to look at the underlying issues, and it's also important to address those underlying issues. We need to highlight the importance of the trauma, stress, and mental health issues. These are the underlying issues, some of the underlying issues. It is important. Think about it this way. Substance use often starts as a way of coping with difficult emotions. Self-medication. It's like trying to put a band-aid on a wound to numb the pain. Like that's all you're doing. You're not addressing the underlying, triggers that are there. Even if you're not actively using this trigger, underlying triggers, internal triggers, the emotions, trauma, they are still there. And the risk of relapse is pretty high. It's so much more higher. So you are having not enough support. And so, during stressful time, when the triggers are there, external or internal, you tend to lean on to this known faulty coping mechanisms. So first, let's really talk about common triggers, that causes relapse. Just to be aware of them will really help you avoid these relapses. So if you can see them coming, you can at least prepare. So let's talk about the common triggers. What are the big ones? Like we already hit on this, right? Like the unresolved traumas, unmanaged stress, or the mental health issues. Those are huge. But the research shows that there are some sneaky triggers, like a lot of people don't even realize it, they don't catch it. And really looking, HALT. So hungry, angry, lonely, tired. The research looks at this. When you're experiencing any of these, you're much more vulnerable to a relapse. When you feel depleted physically or emotionally, it's so much more harder to resist the relapse. So you need to seek support. It's one of the practical ways. It's like you need to identify what is your personal triggers and really make a list. If you feel irritable, it's not the best time to go out and hang out with your friend who pushes that button, and it'll be like you are setting yourself up for failure. So you should know your internal triggers and also the external triggers of taking the same road where you used to go buy your alcohol from the liquor store, or meeting with your friends with whom you've done drugs in the past. So it's important. You need to also work on relapse prevention plan. This is where the idea of setting up a proper plan. You need to get the people in your corner who can understand, who can offer some support, people you can call when your cravings hit, when you feel totally overwhelmed, people you can call to talk to. It can be a therapist, it could be a sponsor from your 12-step program, or it could be a friend or your neighbor, or the patients who are all in recovery. So this is incredibly isolating when you go through this kind of overwhelming feeling. So we as human beings, we are wired for this connection, and especially when you're in an early recovery, you feel isolated. Knowing your triggers, knowing who you should reach out to, and really making those connections. You need to navigate through these challenges so that you can postpone these relapses. So it's the best thing that I could recommend is to writing down your list. Like, what are your internal triggers? What are your specific external triggers? And each individual has their own specific triggers. So then once you make the list, you also go through the different scenarios which could make you a relapse. Just thinking through this, and when you have the cravings, basically playing that tape, that doesn't mean, am I asking you to think about your craving and play the tape? It's so important. It's not just thinking about using the consequences from that. And those things are very important. Relapse is not a failure. As I've been saying this, it only strengthens the resilience. So you can learn from your relapse by looking at it. It's so important to learn through your relapses. Self-compassion is so important. no matter where you are in this journey, you are not alone. You always have a plan for a brighter future. To all my listeners, I want to leave you here today with the thought, if you can design your support network, who would be in your corner? What resources do you need? And please write that down and keep them in your fingertip. This will, because when you are in a vulnerable state, there's no one else out there. And if you had your list in your fingertips, if you had this role played already with your therapist or with your sponsor, this is going to be of great help when you are in a crisis. On that note, I'm going to leave you today with this thought of what can you do? And those who are treating people with addiction, I would sincerely request you not to judge them, not to say they are failing this level of care and have them recommend higher level of care just because they are relapsing. Understand, dig deep within yourself and say, what work can I do more to help this person who is here in treatment with me? And if you're a therapist, look at your toolbox and say, what are the modalities I could add so that this person who's my patient can benefit from this? Instead of just saying that, oh, you failed this level of care. It's not a failure. For some people, it might take one attempt. For the others, it might take several attempts. That doesn't mean they are weak. That doesn't mean they don't have the willpower. That doesn't mean they don't have motivation. That also means that me as a therapist, me as a physician, what else can I give them, right? Thank you. I'll be back with a new topic with you guys. Up until then, bye-bye.